Allison, and you're listening to the Starting Block Podcast. Guys, this is the show for complete athletic development. The objective here is to help you win, whether you're the athlete, the parent, or the coach. Guys, as always, I'm here with my co-host, Chris Scarborough. Good afternoon, sir. How are you?
Good afternoon, guys.
Guys, if you're new to the show, welcome. I appreciate you joining. We operate slightly different than your standard podcast, all right? You're going to get multiple shows within the show from us. So you're going to get a bi-weekly Q&A. That's where Chris and I tackle the questions you guys send to us. That can be anything related to performance, the training, and nutrition, the rehab, the voodoo stuff, anything our guests bring on, and we'll be happy to tackle that. As always, you can reach me on Instagram at FarmerJohnELP. Chris, where can they get you?
Fast and Agile 49.
That's episode 1. Episode 2 is going to be a guest interview. That's going to be just like every other podcast on the planet, where we bring in our friends and colleagues from across the globe, and they're going to share their stories of success, what they do with their clients, their patients, and their gyms and their practices. And ultimately, these are people that we share the same core values and mission with, and ultimately somebody that you guys can connect with. That is what we got today, and I'll bring our guest on here in just a second. But then the final episode that you're going to get, if I can get organized and get back to it, is going to be either that athlete spotlight or that Friday Fire type feel. We, again, as I've said a couple times, we have some good athlete spotlights lined up, but we have scheduling issues. So, because like we were talking about before the show, Chris, we are not professional podcasters. I actually have a full-time job. I actually have 2 jobs. So I try to fit this in when I can, and Chris is the same. So bear with us as we work to get those athlete spotlights out, but we will. And aside from that, guys, we don't run ads on the show, so all we do is ask that if you find value in this and you appreciate the information we're bringing to you, if you get value, if it made you laugh, made you smile, anything like that, just share the show, bring us a friend, and help us spread the message. And so, yeah, pay your dues and share the show, guys. And I think that about covers it. So let's get right to it.
Let's get to it.
Pleased to welcome back for part 2, Dr. Jen Perez of Gait Happens. Hey, Doc.
Woo!
Welcome back.
Welcome.
Hello. Thank you so much for having me. I'm excited.
Part number 2. We were just talking before the show. It's been a year and a half now, I think, since you came on last.
Sounds about right, which is crazy. It doesn't seem like that long, but you know, as we were saying, there's always new things to talk about.
Yep, there are new things to talk about, and as we also said, Chris, I'm not really sure. I didn't really think that people would still be wanting to listen to us, but I guess they do. So, or maybe they just want to hear the new stuff, and we're just bringing that. They can't deal with us. They like the new stuff.
It's usually the guests. Yeah, it's definitely down to the guests
yeah.
that we bring on. Yeah, it has nothing to do with me and John. So,
yeah, not really. So we appreciate you, Jen. You're going to drive the ratings up. Thank you.
Yes.
I'll do what I can.
All right, so you just got back from Japan.
I did.
That's awesome. Let's hear a little bit about that.
Thank you. Yeah, it's been a big year for us at Gait Happens. So for those that aren't familiar with us or didn't catch the first podcast, Gait Happens, we're a foot health education company. So our mission, you know, I love what you mentioned about like bringing on guests that match your mission. And our mission is to change the world. Like plain and simple, we want to change the world by bringing natural foot health to more people. And one of the ways that we've done that this year is we actually launched our own line of products. Now, we're an education company through and through. Like, our main goal is to help people learn how to strengthen and mobilize their feet, how to teach other practitioners to do the same thing that we're doing. But we kept referring to the same simple tools over and over again. So we were like, let's just all put it in a little nice, convenient kit where it all comes together. So we launched that earlier this year, and then just this month, I actually made it to Japan because we are now selling the kits in running stores across Japan as well. So if you happen to be listening from Japan, check out Stride Lab and you can grab one of our kits in person.
It's really cool. I don't know if we have a lot of people. We do have, we have listeners all across the globe. Like, I think, what did we say, Chris? We cracked the top
Israel?
90 in like 5 countries. Yeah.
Yeah, it's like France, Israel,
there are
Sweden.
plenty of countries there. Yeah, I feel like Israel's got other things going on right now, but
yeah, they get a little busy.
Appreciate them listening to us.
Absolutely, yeah, we do appreciate it.
You know, like Israel and Germany are as far as foot health goes, they're actually very centered around natural foot health. They're like hubs for natural foot health.
Really?
Random fact for you.
That is very random. Cool. Yeah. So, all right, I did have one question, and we got a bunch of questions though. But like, you made the comment for people that don't know about you guys yet, and we can dig into this as much as you want, but just. You're an education company. Are you an education company for all practitioners, or do you have to be a healthcare provider? Can you be a personal trainer or a massage therapist or PT? Who can access your courses?
Everybody.
Cool.
So yeah, I mean, we kind of have the full gamut of stuff because we also have direct to the person programs available. So like if you're listening and you're an athlete or you're a parent and you're looking for something for yourself, we have like online programs. We do one-on-one consultations. So we also work with people, but for the health pros, anybody from athletic trainers, coaches, massage therapists, Pilates instructors love us, all the way up to your clinicians, your podiatrists, physical therapists, chiropractors, you name it. So we've got training and certification courses, continuing education, and then we've got resources for people for themselves as well.
Now, you and Dr. Courtney are chiropractors, correct? I mean, that's how the whole thing kind of got started through chiropractic, but
Yeah, we
has
are.
since spread to many professions, as you mentioned.
Yeah, absolutely. We actually have a team now. Our full team's about 12 women, which is awesome. But we have 6 practitioners that are all varied of physical therapist, chiropractor, and a podiatrist as well.
So I'm just going to jump right into it.
Let's do it.
I forgot you were a chiropractor. How does foot function influence subluxations?
Or how does subluxations affect foot function?
Or vice versa? Sure.
Yeah. I mean, let's just talk about like the foot is our foundation. That's the simplest way to talk about it, right? The second that you stand up, the position, the strength, the mobility of your feet is going to affect how you carry your body because it's literally the bottom of your body. It's how you're connecting with the ground. Also, not only from a physics standpoint, but also from a neurological standpoint, it's how your brain knows where you are in space. You know, we have thousands of sensory nerve endings on the bottom of the foot. So you think about the foot itself has 33 joints. That thing was made to move, right? And for years and years and years, the conversation was always support and you need stiffer shoes and more cushion and all these things. But when you look at the actual structure of the foot, between the 33 joints that were designed to move and the 4 layers of muscles underneath there, I mean, it's so beautifully designed and so able to well function. That's not a good sentence, but able to function well, right? When you actually give it the right tools, that it can carry your body effectively. But when we don't have that strength, or when we start to see joint restriction, also known as subluxation, then it can absolutely affect your movement, both dynamic and static posture.
So as far as things like then, so clearly then it can, anything that happens through the foot that's dysfunctional in any way. And it, by the way, and this can happen as a result of footwear that person's wearing that maybe doesn't fit their foot correctly, or it could be from, let's face it, I mean, you know, John and I were just discussing beforehand, and you and Dr. Jen, you were as well. Let's face it, I mean, most athletes have to go out and they have to wear a particular type of footwear, and that might, you know, might set them up for some of these issues if they're not careful. I mean, what are some of the common things that you see? I mean, clearly John already brought up subluxations, but
Yeah.
I mean, what are some other issues then?
No, it's a great question. I mean, you make such a great point that footwear for athletics, it's specialty footwear. It has an intended purpose, right? Whether we're talking about cleats, whether we're talking about ski boots, whether we're talking about climbing shoes for rock climbers, across the board, shoes have certain characteristics to help performance, right? But also let's take cleats, for example, right? The purpose of cleats is so that we can change direction quickly, not slide on dirt, things like that. But somewhere along the way, we decided that, a really narrow foot shape, I should have brought my old cleats in, but a really narrow toe box was the way to go, because the thought was a tighter shoe is going to give you something to push off of, right? Like think soccer. Soccer has some of the tightest cleats out there, sometimes even sizing down to create a tighter fit. But in reality, having that tight fit around the rear foot and the midfoot, but allowing the toes to spread is a really great option to be able to harness the power of the foot and still not slide when you're trying to cut or change directions. So going back to your question of what are some of the stuff we see, well, with that narrow toe box in all of the above mentioned footwear, hallux valgus or bunions is super, super prevalent in athletes. I mean, I was actually looking at the research earlier, and if you take runners, for example, some of the research shows that injury is prevalent in up to 44% of runners. If you think about dancers, especially dancers that are going to be up on their toes, with hallux valgus, dancers can have bunions. Up to 50% of dancers have bunions, when the normal population is up to 14%. Right? That's a huge discrepancy, because now you're taking a pointed shoe and you're bringing it up into plantar flexion, where we're adding 100% of our body weight onto that joint while it's in a malaligned position. And then we're shocked when everybody has bunions. So I feel like that was a long-winded answer, but to answer your question, there's so many things that can go wrong at the foot, especially with the specialty footwear that we need for athletics. So it really calls for preventative care and taking a little bit of extra time on your feet when you're outside of your sport-specific shoe.
So we need some of this specialty footwear for sport. I get it. But aside from that, we want the foot to feel the ground. What are some things that we can do to offset some of this athletic footwear?
It's a great question. So let's start with the toe box, since we already talked about this, right? Number one, check your other shoes. Like, either spend some time barefoot or check your other shoes, because most modern day footwear, regardless of whether we're talking about casual shoes or even your athletic trainers that are on the mainstream market, if you take the insole out of your shoe, so, for those watching, if you take that factory insole out of your shoe and then you put your foot on top of it, it's a very simple test. So you put your foot right on top. Most footwear, it's shaped like a triangle. And when you put your foot on top, the toes are going to fall off the edges. And that's a really good indicator that those shoes, your foot has to conform to the shape of that shoe when you're wearing them. The body is very adaptable. It will move into the position you put it in, and it'll make do. But that's only good until it's not. If we start loading and loading and loading that position over and over again, that's when we start to see issues. So what we want to do is, when you're not in your cleats, get shoes with a nice wide toe box, right? As you can see with this one, this is Ultra. That nice wide toe box, those toes are going to lay in straight alignment. It's not going to compress the toes. Other stuff that you can do is work on your mobility and your strength. And I say that as a blanket term. We can get into what that means, but I'm going to take a breath so you guys can ask more questions.
Well, it's actually a good segue, Dr. Jen, on the kit that you brought up earlier, which I would imagine, and I have not seen the contents of this box yet, or this program yet, but I mean, this might be a good segue of, how can we
don't do
use
ads
this
on the show,
we don't
for
do
the foot box.
Except the foot box, that's it. So, I mean, but curious though, I mean, how can this then, accomplish that goal that you're talking about of hey, let's do some things now that might help. Okay, how can this help our athletes? I mean, our kids that are in these. I mean, I've seen these track spikes. Holy cow! I'm like, how do this guy with his big old foot fit in that little bitty shoe? I have no idea. So I know exactly what you're talking about.
I know. It's crazy. I mean, and you think about like climbing shoes too. They size down like crazy. It's painful for me to think about. So let's talk about the kit for a second, because truly, if you guys find this stuff somewhere else, buy it somewhere else. I don't care. But this is just simple tools that you can use to improve your strength and your mobility. And that's really all that I care about. And if I get that message across, then I've done my job. Whether you get our kit or whether you get this stuff from somebody else, I don't care. So with that, this is the Gait Happens Foot Health Kit. And I already started opening it because it's got this nice slide open. But it comes with foot facts. The really cool thing about this kit is it also, that QR code, it comes with exercises. So it tells you how to use all this stuff. But number one of the things that we always recommend for our patients is toe spacers. Toe spacers, so this is a toe spacer. Of course, I use the one that's cut. So here's a toe spacer. And what it's going to do is it's going to help restore the space between your toes after being in a restrictive shoe. So especially if you're on your feet all day in your cleats and your toes have been crammed all day long, right? The second you take those cleats off, you're going to put your toe spacers on and start getting your toes spread and start restoring that alignment, okay? So that's one simple thing that you can do. Now, you also want to work on tissue mobility. So doing something as simple as rolling a ball under your feet, which we have our own rubber ball that's got texture on it, which is lost somewhere in my mountain of a desk right now. And then the third thing is strength. you want to make sure that you're strengthening your feet. And we can get into the effects of strengthening your feet on athletic performance too, because that's a big thing. But as far as recovery, spacing the toes, starting to massage the feet, let the muscles recover, and then strengthen them, restore that strength. And one of my favorite things, so our kit does come with just like a generic resistance band here, like that you can tie in a circle, use however you need. You can use it for hip stuff, core stuff, arm stuff, like you can use it for whatever. We also have these patented toe strengtheners. And it looks like something so simple, but it was so exciting because there's hand strengtheners out there, right? Where you have these bands that you use to spread your fingers, but there was never anything like that for the foot. So we actually designed these toe strengtheners. They come in 3 different resistances. So easy, medium, hard. And then you loop them around the toes, and now you actually have a resistance band to work on the strength and dexterity of your feet. And it's been really fun seeing people react to these because people put them on and they're like, oh my God, that's so hard. This is the easy one. And then they start progressing and it really makes a big difference. So that's what's in the kit. But the take home message is work on the mobility, work on the strength, grab some toe spacers and restore that alignment of your toes.
How do you assess the strength of the toe or toes? I think that's an interesting topic because with other major muscle groups, it's pretty easy. You can use a dynamometer or just do manual muscle testing, or obviously you could go the meathead route and get under a bar. But when I tell people your feet need to get strong, even I feel like I have trouble explaining like how to assess that. Can you dive into that a little bit?
It's funny that you said dynamometer.
Oh, you have a toe dynamometer. Nice. Okay, cool.
Yeah. So if you're a coach or a clinician and you're looking to actually have a tool to measure the strength, you can get an objective measure using a toe dynamometer. So this is from Human Locomotion. He's the king of all things Gait. He wrote Human Locomotion, the textbook. And so he came up with this. I love it. We measure toe strength. We're looking for 10% of body weight out of the big toe and 7% of body weight out of the outer toes. The big toe is big for a reason. It's supposed to be the powerhouse, right? If you're not a clinician,
in what? I'm sorry, but in what motion, Dr. Jen? I mean, you said 10% in what motion? Like flexion?
Down. Yeah,
Okay.
plantar flexion. So you're going to have them seated. You sit down and make sure that their foot is in front of their knee. And the first thing they're going to want to do is scoot forward so they can recruit their hamstrings. And then you have to go, no, scoot back again, right? So that we're just testing the foot. And then all you're going to do is just stick this right underneath their big toe and say, press down, and you're going to pull it, and it's going to give you your measurement. And you can do pounds, kilograms. We'll do it 3 times and take their best score. But yeah, that's going to give us an objective measure. But for those that don't need a dynamometer, and you want to just do a self-assessment, I've worked with clients all over the world for years and virtually, and I can't do this through a computer. So what I do for those clients is a business card, right? So I actually have them take a business card or driver's license, something like that, sit down and put it under their own toe, try to press down and pull it out. Now, this is not going to give you an objective measure, but it's going to give you a feel, right? Did you feel any resistance at all, or did it just slide right out? How did the right side feel compared to the left side? How did the big toe feel compared to the outer toes? Because it should be relatively symmetrical, relatively, not exactly, and then the big toe should be stronger than the outer toes.
Okay. John, did you know that piece was in that box, or did you just kind of was that just like you being?
I'm kind of surprised they make one of those.
I was like, holy cow! I was like, holy cow, John! How'd you know that? That was I was just about to be very impressed.
Now you said they're available at Human Locomotion.
Yeah, so we do sell them on our website. They're not a part of the kit, but we do sell them on our website as well. Or you can get them at humanlocomotion.com. Either way.
Okay, cool.
That's pretty awesome.
Yeah. All right. So changing gears a little bit, I guess, what would you say are some common limitations and problems that people see that originate from the feet?
So especially with athletes, I think 3 of the most common things that we'll see are bunions, so hallux valgus, especially because of the footwear, like we've already talked about. Another, which I'm going to kind of lump two together, which might surprise people, is plantar fasciopathy, commonly known as plantar fasciitis, and Achilles tendinopathy. And then another one would be ankle sprains. Those are kind of my top. There's plenty of other stuff out there. There's plantar plate tears, there's turf toe, there's runner's knee, there's IT band. There's so many other things that happen with athletes, especially depending on what age group we're talking about. But the three that come to mind, especially for like your more team sport athletes, is going to be hallux valgus, plantar fasciopathy and Achilles, and ankle sprains.
Let's talk about the bunions. I want to spend some time on that because I feel like, and it's very subjective, I don't have anything to support it other than just what I've seen. I feel like I see it more frequently than I used to. I mean, I've been doing this for almost 17 years now, so I feel I see it more often. Maybe it's just because I make all my clients and kids go barefoot. I don't know.
Yeah.
But I'm also seeing a lot more on social media, and obviously I think you guys are leading the charge, but it seems like a lot of people are trying to push things with the foot and bunion correction.
Yeah.
What causes this? You'll hear everything from poor posture and movement to genetics. What is causing this bunion epidemic?
Such a good question. I would challenge to say that because you're seeing more feet, you're seeing more of it. But bunions have been around for centuries, and I think the conversation has definitely become more of a public conversation around foot health, which is so exciting to me. Yeah, I mean, we've been shouting from the rooftops for 6 years about this stuff. So the fact that it's catching on is so exciting. But for bunions, it's kind of a you want to talk about nature or nurture. And there's one camp out there that will say that bunions are genetic. Just black and white, they are genetic. And I would argue that there may be a genetic component, but that our strength, our mobility, and our footwear are going to play a large role in that, right? Just like if someone has a genetic predisposition to diabetes or heart disease, right? That doesn't mean they have to have diabetes or heart disease, like if we're talking type 2. It means let's be a little bit more careful. Let's be a little bit more proactive in making sure that I watch what I eat and I'm a little bit healthier. Same thing with foot health. You can have a genetic predisposition to hypermobility. So hypermobility meaning that your joints are just very mobile. And at the foot, if this joint right here, the big toe joint, first MTP, is hypermobile, and then you stick that hypermobile joint in something that pushes it this way, it's going to adapt to being in that position. It's going to stay there. And then we also see hypermobility here at the metatarsal. So it's actually two things that are happening. Number one, the big toe is drifting towards his friends. And then the metatarsal, which is the long bone behind the big toe, is drifting away. And this is what creates this angle of hallux valgus. And the more mobile that joint is, the more at risk you are. So there's that genetic component. But then on top of that, there's shoes, right? Any shoe that is pointed in the toe, regardless of the angle, right? The pointier ones are the worst. Like you put on flats that look like a pizza slice, we're gonna have problems. But even shoes that are just slightly tapered are going to change the angle of that joint. And now let's go play on it and run and take thousands of steps per day, let alone running and sprinting or jumping. And now we're adding forces at high rate. You're going to affect that joint mechanics. But there's also kind of two different ways bunions show up. I would say there's a hypermobile foot bunion, and then there's more of a pes cavus, which is like a high arch type of bunion. And this is where it's hard to make blanket statements, because I would love to be like, all bunions need to be treated exactly the same way. And to a point, that's right. Like, let's add some toe spacers. Let's use the toe strengtheners and strengthen our abductor hallucis muscles so that we can get better strength and alignment. But then when you look at the rest of the foot, that's where things start to differ. So let's talk about a hypermobile, more like flat or quote unquote pronated foot, right? Which, don't get me started on the demonization of pronation, which is a totally normal motion, okay? But in a foot that lives in a lower arch type, kind of where we lose this stack, right? I like to talk about the stack of the foot and ankle. If you think about the front of the shin bone should kind of bisect that heel, or somewhere relatively close to that. It doesn't have to be perfect, but somewhere balanced. But when we start to lose that stack and things become off center, what happens is we start to open up the joints on that medial side of the foot. So on the inside where that big arch is. This is going to create that angle at the big toe. Can you see how that happens? Right? So that's the one foot type. And in that foot type, I want to be looking at post-tib strength. I want to be looking at calf raises with a ball between their heels and how can I strengthen the arch and the medial column. The other foot type is your pes cavus foot type, which is like super high arches, super rigid, and now we have a hard time. This is what they would call a supinator. Again, a totally normal motion at the foot, but someone who has a hard time with pronation. They don't really feel that unlocking or spreading of the foot. And what can happen there is now if I've got this super high arch that doesn't unlock, if I'm stuck here and these joints don't move, I'm going to try to get all of my pronation from my forefoot. And we end up with a hypermobile forefoot because the midfoot won't move. So in those people, I'm going to be using a ball under the foot. I'm going to be in there doing joint manipulation. I'm going to be doing whatever I can to get the midfoot moving so we quit asking the forefoot to move so much to make up for it.
By the way, I want to just say something real quick. If you're listening to this on either Spotify or Apple Podcasts, this is one where I definitely would recommend you put it on the YouTube video, only because we can actually see the skeleton model, and as Dr. Jen is explaining this verbally, she's actually demonstrating with the skeleton model, and we can kind of see. Because I wouldn't have been able to have followed that without the model, and that really helps. So, and I think a lot of people can benefit from that. So,
yeah, this is a disclaimer on all podcasts that I'm on. Is like, if you're listening, go to the video. It's way easier.
Go to the video. Yes,
I'm trying
totally.
To verbally describe it at the same time, but it's really easy to see. It's a little bit harder to hear.
Well, by the way, and also, I want to kind of give your Instagram a plug. You pretty much demonstrate this, all these things. And it's, I know we brought up the whole foot kit thing, but there's a lot of cool free information out there just on your Instagram that all this stuff is out there, and it's amazing information, which is how we found you. But this is, it's interesting because most people would never think that, oh, it's a bunion. I just got to go have this thing sawed off. And then, 3 months later, how many people do you know had a bunion surgery that we say had never done that?
Yeah, I've seen a couple.
Yeah, I've seen a few. So anyhow, I'm sorry. Please continue, Dr. Jen.
Oh, it's a really valid point because surgery exists for a reason. I'm not here to shame people who use orthotics. I'm not here to shame people who've done the surgery route. Like, you've got to do what's best for you in your body and in your goals and your athletic ability. Like, every case is different. But the problem with bunion surgery that I find, because the most recent research I've seen shows that about 1 in 6 bunion surgeries fail. And I think I don't actually blame the bunion surgery. I blame the post-op care because nothing changes, right? They get the surgery and then they're like, okay, great, my toe's good to go. I'm gonna go back into the same shoes. I'm not gonna do my strength. I'm not gonna do my mobility. Most of the time, there's not even rehab prescribed after foot surgery, like bunion surgery. And so they go do all the same things that caused them to have a bunion in the first place. And then we're shocked when the bunion comes back. And so it's, I think it's that conversation of we need to have post-op care and also be preventative so we don't get there in the first place.
Go ahead, Chris.
Oh, I was just going to ask, have you ever noticed anyone make like a significant improvement, not just in the function of their foot after the, I'm sorry, please correct me if I say this wrong, hallucis valgus. Did I say it right? Okay, so
Hello.
Have you ever seen anyone correct this purely with the mobility, with the strengthening? And let's say someone's really diligent. Can they not just improve the function of that foot, but the appearance? Because, a lot of people don't like the way it looks. So,
Totally. Yeah, it's a great question. So I have to be careful with my wording and my claims here, but you can definitely see improvement. So the key there is the severity. So the gold standard for determining the severity of a bunion is X-ray, because you have to be able to determine what's called the intermetatarsal angle. So how far that first metatarsal has deviated outwards. That's going to determine, is it mild, moderate, or severe? And mild to moderate bunions can absolutely improve with conservative care. So changes like footwear, strength, stuff like that. In my practice with my patients, I see improvements not only in the function, but also in the appearance and most significantly, the pain level all the time. You know, people who couldn't go to the mailbox or had to cancel a trip because their pain was so bad they weren't going to be able to walk around Europe are now like, you know, I have one guy that comes into mind that he just booked a 2-week trip across Europe that's a bike and hiking trip that he never would have thought of that before. So it's you can absolutely see improvement in the function, in the appearance, and in the pain level most of all. I can't use the word correct bunions, but you can see improvements.
Right. You touched on the strength of some of the other muscles aside from the foot. And don't get me wrong, the strengthening of the foot muscles themselves obviously is very important. But what do you see as a correlation with some of the, let me rephrase that. I think a lot of people, when they would say, like, we got to do strength and stuff, and I got to work on my Achilles and things like that, they're just going to think calf raises, or maybe they'll think like doing anterior tib work. But what about the correlation with some of these other muscles, like the peroneals, or like, do you see dysfunction there that can ultimately lead to some of these foot issues, or maybe even a little bit higher?
Yeah.
Up the chain.
Oh, you're getting me excited, John. Okay. So, I mean, there's so many ways we can go with that question. So, just touching on the highlights of calf raises. Calf raises is one of the questions you guys sent over to me was like, if there's 3 things every athlete can do, like calf raises is one of them, period. And especially, I would even incorporate toe strength into the calf raise by either doing it with like the toe strengthener on, so you're activating the foot, or even just adding a towel under the toes so that you're engaging the toe plantar flexors while you go up into a calf raise. There's so many calf raise variations. And that's going to directly affect like Achilles tendinopathy and plantar fasciopathy, which is why I kind of lump those two together. Because if you stop thinking about the plantar fascia and the Achilles as 2 different things, and instead think of them as one connected fascia that's just above and below the heel, now you can start to see how they're going to affect each other. So we're looking at calf strength, especially soleus, getting some seated weighted calf raises. The gold standard for seated calf raises is 1.5 times body weight for 6 reps. Single leg.
Ooh, okay. I didn't know that. I'm going to write that down.
Well, it's interesting you said that, Dr. Jen, because years ago I ruptured my Achilles tendon, and it was very odd in that I was a middle-aged man that ruptured the Achilles with no prior history of either Achilles tendonitis or plantar fasciitis. And apparently almost every middle-aged male that has this issue has one of those 2 problems. And pretty much, they pretty much agree with exactly what you just said.
Yeah.
You know, you don't think of plantar fasciitis as potentially leading to an Achilles tendon rupture. Yeah. And again, that was not my problem, but it's still, I was kind of interested to hear those stats after the fact, you know, that it's just as common for a plantar fasciitis patient to rupture an Achilles as it is Achilles tendonitis rupturing the Achilles. If that all made sense, it's kind of roundabout.
Absolutely. I mean, it really is all connected. You know, speaking of all connected, like let's talk about the peroneals for a second, because that's definitely peroneals and post tib are like 2 of my favorite muscle groups.
I feel like they are chronically weak or down-regulated with everybody.
Yeah, I mean, especially, you know, some of the athletes we talked about were volleyball players and soccer players. 2 of my biggest populations for ankle sprains, right? And now, so with an ankle sprain, especially, you're typically talking about an inversion ankle sprain. That's going to not only compromise the ligaments on the outside of the ankle, it's also going to compromise all of the tendons that are coming down and wrapping around the outside of the ankle. So again, for those watching, you can see this is the peroneal muscles come down and wrap around the outside of the ankle. And then 2 of them attach on the outside of the foot, and one, peroneus longus, is going to actually wrap underneath the foot and stabilize the first metatarsal. So one more example of how everything is connected is, let's say you have a history of chronic ankle sprains, and now all of a sudden you're getting big toe pain, whether that's on the top of the joint, so we're talking about probably hallux limitus, or on the outside of the joint and you're starting to get the beginnings of a bunion. Well, we already talked about the stability of the first metatarsal and how important that is in stabilizing this joint. So if I have chronic ankle sprains, now my peroneus longus is compromised. If I haven't specifically done training in my rehab process, and then I don't have the stability for that first met, this is going to start deviating outwards. We start to see that bunion, or we have a hard time planting that down, and then we start to see that hallux limitus, which causes the pain on the top of the joint. And those are things that typically come into my office with people in their 40s, 50s, and 60s, where now this is turning into arthritis. And then I'm the person asking, do you have a history of ankle sprains? They're like, yeah, in my 20s, I had ankle sprains all the time. Well, maybe if we have the athletes now with the ankle sprains, we can be proactive so that they don't end up in my office in 20 years.
Mm-hmm. Yeah, you could see where that could even lead to, itis is up the chain. That same person may not have big toe, but they could have a knee problem as a result of that.
Yeah.
I mean, I could.
For sure, right? Because oftentimes they also now have a tendency to load the outside of the foot because they have such a hard time grounding the inside of the foot. So when we have that tendency to load the outside of the foot, we're going to put more stress on the peroneals. We oftentimes can end up with peroneal tendinopathy or pain on the outside of the foot and ankle. And then you follow that up the chain because we have that whole lateral line, which starts with the peroneals, goes up into the IT band and the TFL. And now you start, maybe in your 40s, you decide you want to become a marathon runner, and you start loading the outside of your foot over and over and over again, which is loading the outside of your leg. And we're never getting to that medial chain where we're getting more adductor or where we're getting more post-tib or big toe engagement. I can also dive into pelvic floor with that too. I mean, the big toe.
That's a statement you made on the last episode we
Yeah.
did, and I've used that a ton. I've directed them to you, so I was going to follow up right there when
Yeah.
you were done and say, I want to hit this before we close this out. So,
Yeah.
where are you on the pelvic floor and the big toe correlation now?
Yeah, I mean, it's essentially, if you think about what we just talked about, that connection from the whole outside of the leg, now imagine it on the inside of the leg. So from the big toe, we're going to go, so we have FHL, which is flexor hallucis longus. We're going to come up the inside of the ankle. That's going to be your post-tib, which is one of the biggest stabilizers of your arch. You're going to follow it all the way up your adductors into the groin. And then you follow that right into the pelvic floor. So for those that are listening that don't know what the pelvic floor is, which is totally okay, it's all of the muscles that make up the bottom side of your torso. And this is something that both men and women have. It's literally just muscles. And if you think about the bottom side of your torso as a trampoline, those muscles have to be able to adapt. And our core think of your core as a cylinder, like a Coke can. And if the outsides, our obliques, our transverse abdominis that we're always talking about, that's the sides of the Coke can. The top of the Coke can would be your diaphragm, and the bottom of the Coke can would be your pelvic floor. And all together, they have to be able to regulate intra-abdominal pressure. And if we don't have good pelvic floor control or good pelvic floor engagement and relaxation, then we can't create that really good intra-abdominal pressure. And sometimes that stems all the way back down to not being able to ground through the inside of our big toe and through our feet.
Awesome stuff right there.
Yep. I think that those, we get asked all the time, and it's almost like everyone knows, everything's tied together. But let's face it, very few people can explain it the way you did it. No, that's pretty awesome.
Yeah. I mean, one of my favorite things to do, because I'm a total nerd, is to look up the anatomy trains, looking at the fascial lines. So the deep front line is the one we just talked about. So it's going to include your FHL, your post-tib, adductors, pelvic floor, diaphragm. It's such an overlooked connection. There's also, we didn't even get into like the neurology of the foot, but there's also a neural connection between the big toe and the pelvic floor. So they found, there's a study that found synchronicity, which means that the brain fires two muscles at the same time. And this happens when, our brain's really good at becoming efficient. So if it finds that we keep firing two muscles over and over at the same time, then it automates that process. And they found synchronicity between the big toe and the anal sphincter, which is part of the pelvic floor. So it just really goes to show, like, we may not understand the neural connection, but our brain does. It knows that the foot is connected to the pelvic floor and how important that is.
Wow. That's a lot to take in right there.
Just an information dump all at once.
Yeah. No,
It's all
keep going.
good.
Just
No, it's
keep
all
going.
good. Yeah.
Yeah. Again, I don't want to make, I'm not going to make claims. And again, it's one of those things where, if you want to buy a red car, you start seeing more red cars on the road, right? Can't remember exactly what that's called, but same thing. Like, I feel like there's been an exponential rise in pelvic floor care.
Yeah.
And maybe it's just something I've seen. Maybe it's actually happening, but I genuinely wonder how much of that is related to actually poor foot function and the fact that it's gotten worse, and probably since that big C word that happened 5 years ago, people aren't getting out moving as much, and things are just locked down.
Well, I think too, it's also about the conversation, right? Like, just like with foot health, and how for years, like, people just kind of ignored the foot. They were like, oh, you got something wrong with your foot? Let's just put a brace underneath it, and like ignore the actual function, like treat the foot like we do every other part of our body and try to strengthen it. That's like a new concept to people. And it's the same thing with the pelvic floor. The only time the pelvic floor used to ever get talked about was, post-pregnancy, post-birth, talking about what's called prolapse. And it was like, when things went wrong, we're going to surgically help you, and that's about it. But then in recent years, the conversation is getting out there that, no, this is made of muscles. We can relax, we can strengthen, we can actually work on the function of the pelvic floor. And it's kind of like they're happening at the industries are happening at the same time, but they're so parallel in function too. We actually have a pelvic floor PT in our office, and I love referring back and forth. Like, we have patients that'll see me and see her in the same day, and we work together, and it really creates a powerful response, especially for athletes that are postpartum, and that have stopped running because every time they run, they pee a little, and it's either they don't want to, or it's embarrassing and they don't want to talk about it. And now it's a conversation that's actually okay to have, which is so empowering to those athletes.
Let's talk a little bit about orthotics.
Yeah.
When is it appropriate to wear them? When is it not? Because I feel like anytime anybody comes in with plantar fasciitis, that's the first thing that they are prescribed is an orthotic, or to go get a specialty shoe made. So I guess I'll wrap that in there too.
Yeah.
What about orthotics and these specialty shoes?
Yeah. How about we just arch it, or put it all under arch support, right?
There you go, arch support.
So arch support, if you think about load, right? Load versus capacity of a tissue. So overall, this is like the across the musculoskeletal system. Pick a tissue, whether we're talking about the Achilles tendon, whether we're talking about the plantar fascia, whether we're talking about a muscle, it has a certain capacity. And as long as the load that we put on that muscle or tissue is underneath that capacity, we're in the green zone, right? But the second we start overloading that tissue is when we start to see injury. And especially when we do it over and over and over again, that's when we see chronic injury. And especially things like plantar fasciitis typically end up becoming chronic. And one of the ways that now, if you look at that equation, right, here's my capacity, and then my demand is above that, one of the ways that I can fix this equation is to decrease the demand. And an easy way to do that is arch support, right? And arch support is going to offload the plantar fascia. This is why it's become very, very popular as a treatment for plantar fasciitis. But the research shows that this should be a temporary fix, right? Just like you don't live in a cast forever after an injury, you don't live in orthotics forever after an injury. But that's the part of the conversation that's got lost in the mix. We need to be using them as a treatment strategy that then we work our way out of. We need to be working on strength in the meantime, rebuild that tissue capacity so that when we take away the orthotic and that load goes back up, our tissues can handle it, right? So working on strength is a really good long-term solution. I don't have anything against short-term orthotic use. I have a problem with most long-term orthotic use. My caveat to that being structural abnormalities, which typically is going to be either like a congenital deformity like clubfoot, or something that's become, a fusion post-surgical, or severe arthritis, stuff like that. But in the vast majority of people, orthotics should be used as a temporary solution, if at all. And I mean, I think I can count on my hands how many times I've prescribed orthotics in the last 6 years. So they're a tool in the toolbox, and some people may benefit from them, but I also think when we talk about kind of prefab over-the-counter orthotics versus custom orthotics, again, outside of that like structural deformity conversation, because that's a totally different conversation. But for the average person, is it worth investing $400, $500, $600 in orthotics that then you're going to want to get rid of anyway? Or should we just get some over-the-counter orthotics and work on strength and then get rid of them? And I usually lean towards the latter, if at all.
One thing, and by the way, this might be something, John, that we may need to wait till next time, because it's something that I'm fascinated with, and that is, and this would cover really rehabilitation of an injury in any part of the body, because I mean we deal with athletes that have they're overcoming injuries, shoulders, neck, I mean back, ankle, knee, I mean you name it.
Yeah.
But that's the impact of not just a person demonstrating strength and being pain-free, because the problem that I see, and John, you probably see this too, as soon as they go back to sport speed, not the strength and not the pain level at a slow speed, it's things done at the velocity of the game.
You make
Then
such a good
then the symptoms come back. I mean,
Yeah.
do you have any kind of suggestion that any kind of precaution we need to take when dealing with athletes or dealing with these type of injuries we've already talked about, but now we got to get them back into sport speed?
No, it's such a good point, because so many treatment protocols stop when they hit normal capacity, right? We're looking at strength and mobility. Okay, you hit your ranges of motion, you hit your strength goals, you hit that 10% on the dynamometer, we're good to go. But really, we need to be looking at sport-specific goals. So, whether that's, going back to strength for a second, if I'm working with an ultra marathoner, I'm also not only looking for 10% of body weight out of the big toe, I'm doubling those numbers, because their demand is so much higher. So going back to that capacity demand conversation, the demand of the sport is not only the strength and the load, it's the speed of and the rate of loading, right? So we should also be looking at plyometrics. Can you do these exercises? One of my favorite things is also from Human Locomotion. He has a device called the Toe Pro, and it's basically just a foam platform that you can do calf raises on, and it would engage your foot intrinsics and your calf at the same time. I use it all the time with patients, and I say, okay, once we can get to a point where we can do our calf raises, we can do our single leg calf raises, that thing will humble you on your calf raises, by the way. Now, I'm going to do pulses. I want you to get on that thing and you're going to go up, down, up, down, up, down, up, down, up. And now we're getting the strength and the speed. Okay, now that we've conquered that, it's time for a hopping protocol, multi-directional hopping protocol. We have to look at the rate of loading in addition to the strength and mobility. Such a good point.
Yeah, I'm pulling up. Oh, I have seen this Toe Pro.
Yeah.
Yeah, I have seen that.
I don't think I have one here. I think it's at my office. But yeah, it's another very simple tool. It's literally just a block of foam, but because it's at this angle, the foam adds resistance to your feet. You have to engage your feet while you do the calf raise. And like I said, that thing's going to humble you. So yeah, if you guys do...
It's hard. Yes, I've used it.
If you end up going to Human Locomotion, you can use discount code Gait Happens. It'll save you some cash.
All right, good deal. Let's see. I think there were a couple other questions we wanted to ask Chris. I think did we already talk about it?
For the most part, we've kind of wrapped
to the end here.
Yeah, we've kind of wrapped it in.
Through.
Yeah, I know we talk about the plantar fasciitis, the Achilles, the ankle sprains, and the big toe, and I feel like we kind of weaved them into the other topics.
We bounced around.
Yeah, just real quick.
Welcome back to our show. That's how we operate
Absolutely.
here.
Just real quick on shin splints. Just because I've got a
there you go.
team full of people with kids with shin splints at the moment. Anything specific that we tend to find that something can really benefit them, something they're deficient in. Any kind of info on that right now. I could use tomorrow. So,
so again, going back to strength testing. So, so shin splints, there's kind of two things that happen there. Number one is medial tibial stress syndrome, where we're actually overloading the tibia itself. And that comes down to shock absorption. How is the foot hitting the ground? So do they have that more rigid foot type? Do we need to work on the ability to pronate? Do we need to work on unlocking the foot? So that could be like joint mobility, or it could be, one of my favorites is roll up your sock, stick it under the arch of your foot, and then all you're going to do is just rotate your body to the left and right. Now, if I'm talking about my right foot, so my right foot, think about my right arch. And for those listening, if you stand up, this will make way more sense if you do it with me. But you're going to think about your right arch, and when you rotate your body to the left, your right arch should lower down. It should pronate. And when you rotate your body to the right, don't suffocate yourself over there, John. When you rotate your body to the right, your arch should lift. So by adding a sock underneath the arch, it gives you a kinesthetic cue of, okay, I want you to stand there and do 40 rotations. And when you rotate to the left, let your foot go down into that sock. Let it pronate. That's a great one for people that have that higher arch type. But going back to the other thing that we typically see with shin splints, which is a weakness of tibialis anterior. And that's where strength testing can be really, really helpful. Again, starting with strength, and then you're going to go into plyometrics afterwards. But knees over toes guy is a really great resource for tib anterior stuff. And we actually had him on our podcast a long time ago. And I want to say, and unfortunately, I can send you the confirmation, but I don't know off the top of my head. I want to say it was 16% of body weight was what he was looking for. And there wasn't research on it. It was just his experience. But 16% of body weight was what he was looking for tib anterior. I usually in the office, I have a single leg tib raise bar, and I'm usually throwing, depending on the person, I'll start with 5 pounds, then I go to 10 pounds. Most people at 10 pounds, if this is an area that's affecting them, they can no longer do a tib raise. Right? If they're sitting on a bench with their leg extended, foot off the edge of the bench, and we're looking for a tib raise with 10 pounds on it, and even if you just use a kettlebell and stick your foot through the top of the kettlebell, a lot of times, especially trying to control the way down, you're going to see the foot going all over the place, and a big discrepancy from side to side. If they only have shin splints on one side, I would be looking at both sides, and if you see a huge difference there, guess who's getting weighted tib lifts as part of their protocol?
Nice. I love it. All right. I got one other question as we get close to wrapping this up, because I know you've got a hard stop too, Doc. So I want people to hear it from you. I've always been looked at as the weird guy in the area because I make my athletes train barefoot, because I believe the foot is crucial for development. What are 3 top things, easy things that athletes can do for their foot health? Just when they come in to work out, what could they do? Or at home.
Go barefoot.
Go barefoot. Okay, there's one.
What you were looking for, right? So let me talk about the benefits of barefoot for a second, because there's many benefits of barefoot. So from a mobility perspective, it's going to allow you to spread the toes. It's going to keep that alignment of the toes. Spreading the toes not only helps with pronation, so shock absorption, it also initiates what's called the tie bar mechanism of the foot. When the forefoot spreads, it creates stiffness across the ligament across the forefoot. And that ligament is tied into your plantar fascia. This also gives a reflexive contraction of the muscles underneath your foot, which is what you push off of when walking and running. So all of this to say, you have to be able to spread your toes in order to properly engage the muscles under your feet, which is the primary mechanism of push off. This is also why foot strength is so important for athletic ability. I was looking at some athletic research a couple weeks ago, and they have shown that a foot strengthening protocol can improve, I want to say it was 40-yard dash time. It was definitely sprint, vertical jump, horizontal jump, and change of direction. So why not, right?
Yeah.
So going barefoot, or even wearing minimalist shoes. So minimalist shoes being super, super thin, flexible shoes that are basically like going barefoot, but protecting you from glass. Wearing minimalist shoes has also been supported by research to show that it will strengthen your feet. Going barefoot, wearing minimalist shoes will strengthen your feet because your feet have to do the work. When you're in shoes that have a lot of cushion, especially shoes that have what's called a forefoot rocker, so where, like all the shoes that you see that lifts at the toe, when you have that forefoot rocker, you don't have to push off the foot anymore. You just rocker right over it. So our feet get lazy, and it can actually start to lead to atrophy because it decreases the amount of work our feet have to do. So one of the key points is go barefoot, wear minimalist shoes, build up safely, please. The feet have to strengthen over time, just like everything else. So don't just jump from like super max cushion shoes to going barefoot. but build up slowly. But those things can help strengthen your feet and improve your mobility. So that's my number one.
I love it. I love it. As always, Doc, you do great work. Like, we love the stuff that you do, and you've always brought on great info to the show. Thank you.
Thank you
Love
so
that
much,
stuff.
Dr. Jen.
Thank
Yeah,
you.
Guys,
absolutely.
Dr. Jen, where can people find you?
Yeah,
When they follow you.
Chris mentioned earlier our Instagram, Gait Happens, so Gait Happens. We also have a YouTube page if YouTube is your vibe that we're working on building out. We have thousands of videos on Instagram. We've got, maybe 100 on YouTube, but they're longer and more thorough. So those are some free resources. You can also find us at gaithappens.com. We've got a full blog of resources. We've got programs and courses. We have the new foot health kits. We've got just the toe spacers, just the toe strengtheners. We're here to be a resource for you. So, and if you have questions, number one, we have a new chat feature on our website called Archie, which I think is hilarious.
That took a second. I
Yeah.
got that now, though.
Our AI chatbot, we got to name it, and the team voted on Archie, which was awesome.
It works. It works.
Yeah, but we also, you can reach us via email, so info@gaithappens.com. So all the ways to find us, all the ways to answer your questions, because like I said, our mission is to educate the world. So I'm very, very excited that you guys asked me back, because this is how we do that, is by sharing this information with more people.
Yep. Good stuff. Great stuff, as always, Doc. Thank you.
Thank
Guys,
you so much.
you know the rules. Pay your dues. Share the show.